Welcome to the Neurology Nuts and Bolts podcast, all about constructing your career in neurology. I'm your host, Sara Schaefer from the Yale School of Medicine. Today, as part of the Types of Careers series, we will be speaking with active duty neurologist Jennifer Crum Bailey and active reservist Rachel Rosenbaum about a career as a neurologist in the military. Thank you for joining us, Rachel and Jen.
Thanks for having us.
Thank you.
So let's get back to the beginning. At what point in your careers did each of you start to consider joining the military and why? Jen?
I was actually not a medical student, sorry. I was an undergraduate student, and considering medical school, I'm looking at all the options for basically paying for that. And that's kind of when the military route popped into my mind.
And what about you, Rachel?
For me, it was very similar. I am a late to medical school second career person, and I was finishing my master's while I was in medical school, and I really did not want to be tied to picking a subspecialty based on finances alone, and I really wanted to be involved in some sort of service. So I actually looked at the military, and I looked at the Indian Health Services, and I looked at rural health programs. And then I was fortunate enough to be brought on a tour down to Brooke Army Medical Center. It is now under a different name, SAMC. But I went down for a tour to see what military medicine was all about. And I was so impressed by what I saw that I decided to go active duty Army.
Can you tell us a little bit more about what impressed you about that tour?
The resources in military medicine, when you look at the unfortunateness of the war that we were involved in at that time, which was a very long war, some of the resources and some of the battlefield advances that you see in medicine come out of those spaces. So Brooke Army Medical Center, which, as I said, is now called SAMC, or the San Antonio Military Medical Complex, is the military's only level 1 trauma and burn center. It's also the only burn center for the region. It's located in San Antonio. And they actually had an ICU plane, and the plane was equipped to go and pick up soldiers that were hit by IEDs and be brought back directly, because there's a very special way that you take clothing off of burn patients. So there's an entire crew that goes, an ICU crew that flies, and our soldiers are brought back that way. And I just thought that some of the things that you would be exposed to in training and the people you would be serving was just so impressive, and nothing that you'd ever see in the civilian healthcare side.
Can you tell us about the process of joining the military and the requirements as, an undergrad student, a med student, a residency, and further in your training, fellowship, and beyond as you become an attending?
So the process for joining the military, it does vary to some degree on what part of your training you're joining. The initial aspects of it, though, are very similar to what you would need to go through for really any federal position in terms of background checks for security clearance. Obviously, they're going to vet through your credentials. One of the big differences for joining active duty is you have to undergo physical examinations and kind of a review of your medical history. So there are many things for entry into service in terms of medical conditions that are disqualifying to actually join onto active duty. So you'll go through this. It's a lot of paperwork of seeing if you're eligible. And then after that, it depends on where you're at. So I mentioned that I had started looking into this process as an option when I was in undergrad. At that point, I was able to sign through conditionally with acceptance to medical school. So I did the HPSP route and signed my oath of office and letter of commitment prior to starting medical school. So that's one route versus some people come in while they're in medical school already. So what that looks like, they have to go through that initial step, but then their year of commitment paperwork might be different based on how many years the military is paying for your schooling. And that's similar for fellowship too. So, essentially at any point of whether you're thinking of medical school to residency to fellowship to being a seasoned physician, a lot of the paperwork that you kind of fill out and what you would want to pay attention to is really your commitment duration, which depends on what the military is covering for you up front. All of them require the same level of medical clearance. And then it varies again based on at what point, if you're going to go straight to active duty or if you're going to go into a reserve status, which Rachel can talk towards a little bit more. The other route that can go is you can do HPSP prior to medical school or joining, or you could sign on or be accepted to the Uniformed Services School in Bethesda, and that's a different commitment. You do your medical school training with the military, and that has a longer commitment than the HPSP or kind of a fellowship payback.
Rachel, do you have anything to add to that? And I'm also interested in hearing from both of you if you decide which branch of the military to join and how you make that decision or what might go into that decision.
Absolutely. So I was also an HPSP student, but I joined a little later. So my commitment was only 3 years. And because of my age, I actually required an age waiver for joining. I was 35 at the time, which was slightly higher than what their requirements were for. In regards to if you wanted to join and be in the reserves, when you talk to the recruitment teams, they can explain the difference of things like STRAP, which is money that you receive while you're in residency, but you're serving in a reserve slot. You're not going to come on to active duty. And the medical recruiters know the details and can also get applicants in touch with both active duty physicians as well as reserve physicians so they can ask questions. As far as looking on which branch you want to serve in, the way I made my decision is I looked very carefully at which branch had what training programs and what their requirements were. The Marines do not have an inherent medical team. They are served by the Navy. So you'd be looking at the Navy, the Army, or the Air Force for active duty slots. All of them have different training locations for residencies. All of them offer different programs. Some of the programs in certain branches require you to go out as the equivalent of a general medical officer before you can come back and apply for certain residencies. So you might not slot into residency and go straight through. So you need to be asking those questions and making sure that programs that you're interested in are available. And all of those things are why there's medical recruitment teams in all branches of service.
And Jen, how did you make a decision about the branch that you decided to join ultimately?
I would say very similar to Rachel, that when I was looking at the 3 different services, at that point in time, I was really undifferentiated in what I wanted to do. And so I chose by which branch had the most options, the most training facilities, just to allow for having options whenever I did decide. But if you have a better idea, or, perhaps maybe you're already in residency or kind of self-selected, a lot of folks will sort of look at what the different service branches do. So there's a big difference between life in the Navy, life in the Air Force, and life in the Army. And so folks kind of come to that decision in a lot of different ways. Some just based on sheer number, some based on what they're interested in, and some based on the fact that, they just like the recruiter one way, for one branch more than another. Or they, thought one had better duty location. So that's another thing folks will look at is options for down the road after training. I will say most of the medical requirements across the board for the 3 service branches are fairly similar. There are some differences. So if it's something really mild that's keeping you from joining one, have the recruiter kind of look and cross-reference that, or reach out to the recruiters from the other service branches and see whether or not that's a exclusion for entrance.
So going past the joining phase, while you're actually in training, either in medical school or undergrad or residency or fellowship, are there requirements that you have to, go to some kind of training a couple times a year or anything like that?
It depends on kind of what status you're in. For instance, probably the most traditional route is, I'll just use this one as an example. So I was HPSP. When I signed my oath of office, that was with the reserves. Okay, so I did my 4 years in medical school, just like all of my other classmates. I did have two, what they called ADTs, or basically temporary duty times, that were, I think, 6 weeks at the time. This was many years ago, but where I went on to active duty service, but that was used for my audition rotations for residency. So I used that time to do that. And then the other thing, before you come on active duty, which happens upon graduation from medical school, you got to go to officer basic training. So a lot of folks will knock that out over kind of a summer break or some break that aligns with an officer basic course, or they'll do it immediately after graduation before entering the residency. So if that happens, sometimes it may delay you starting your internship for about a month, but unlike the civilian programs in the military, there are so many reasons why people are delayed for internship that it's really something that happens quite often, that you just sort of like pick up. And we have a lot of experience with working with folks that are off cycle. It used to be where folks could go after their residency, but they've really gotten away from that in the last, I'd say, 5 to 7 years. If you're already in residency, it would be similar, that you would complete your residency, and then upon that you'd have to go to officer basic training before you took your first duty station, your first job, with the military. Similar with fellows, or similar with staff that have been out practicing in the community and then want to join active duty service.
And you keep talking about officer basic training. Are all medical doctors who enter the military on the officer track automatically?
Correct. Yeah. So Rachel kind of alluded to, there's really two segments: the non-commissioned officer, or that's the enlisted individuals, and then the commissioned officers. So that's all your doctors, your nurses, your lawyers, folks with some type of a degree and specialized kind of professional career.
So you talked a little bit about, in undergrad, Jen, you deciding to enter the military, at least in part because of the loan repayment structure. Can you talk a little bit more about that and what other perks there might be?
It has changed, and I admittedly am not up to date on what the current reimbursement and all the bells and whistles of what it would look like for a medical student or a current trainee in residency in terms of payback and what they give you. But when I was making that decision, I'm from rural Pennsylvania, and so I really weighed, and my father is a retired military, so I had some familiarity with sort of the military life a little bit. I actually spent most of my life not wanting to do anything and with the military, but then after 9/11, kind of just wanted to spend some time in public service. But I looked at doing rural stuff just in the community, because there's a lot of options to have like medical school paid for if you're willing to, give up a couple years of your career for serving back. But what I liked about the HPSP scholarship was that, it provided me a ton of just financial freedom. And I think it's actually better now than it was before. So I did have, one of the misconceptions was if you have no loans. I did have some loans because I had to like pay for my rent, but the cost of living allowance has gotten better, I understand, than it was when I signed the dotted line. So talk to the recruiter about, monetarily, but historically they cover your tuition, your books, like anything required from the school is paid for. You just have to have the school like basically print a letter saying we require this, and it's no questions, everything's paid for. And when you're talking about tuition completely being paid for, it's tremendous. And then I had like a substance or allowance pay that gave me so much money per month. And so that's what it looked like and how that worked for me. So I was not debt free, but comparatively, I was in a much better position than my peers. And then the other advantage of that route is doing your residency and internship. Your financial income is substantially higher than what the average intern or resident in the community has. So you get your officer pay. And so that was also really nice. So I was able to really plan and be financially sound early on in my medical career. And for me, that was always something that really weighed on me, and I didn't want that stress. So that was kind of a level of blanket of security that I really, really enjoyed.
All right, Rachel, do you have anything to add to the perks? And also, do you want to comment about the drawbacks? You mentioned moving every 3 years, which maybe some people would see as a drawback, whereas other might see as a perk. But can you tell us about how that works and any other perks or drawbacks?
Absolutely. So I agree with everything that Jen has just said. Definitely check with your recruiters. The monthly stipend plus cost of living, plus there's now a bonus which comes and goes. You really start off with less debt. The other perk or benefit of being in the active duty military is it is a job that allows you to be qualified for the public student loan forgiveness program. So if you come in with a lot of debt separate from the medical school debt, but other student loans, if you paid for your undergrad or you paid for your master's or what have you, you are eligible for that program. And that's a really big deal, as this is pretty much the first year we've seen people start to get loan forgiveness. Other perks that I saw for joining the military, I really like the fact that everyone in the military has the same health care. The benefit of having single payer health care for my service members and their family members. And you pretty much worked with TRICARE, and then you might have TRICARE with a Medicare behind it for some of the retirees. But it really was a system that allowed the same answer and equality amongst people that I found very attractive. I found the option to move very attractive as well, because it's very difficult if you want to, let's say, open a practice. It's going to be difficult to move around the country. How are you going to decide where you want that practice to be? The neat thing about military medicine is that when we pick up and go from one location to another, the clinic staff is already inherent to the next location that you're going to. All of those resources are set up for you to slot in and out of. It allows you a lot of opportunities and experiences, both in the continental US and abroad, to live and work in places that you would never be able to just pick up your practice and go. So it really gives you an advantage, even if you don't want to stay and be a career 20-year military person, of really having exposure to all the different areas in the country that you might never have an opportunity to explore. And you might find some place you really do want to stay at. So I think that people can see moving as a drawback. Frankly, in the military, when you move, the military movers show up, they pack your stuff. The next day they show up, they move your stuff. I didn't have to arrange those movers. I didn't have to do the work. I have friends that have been stationed all over the world. We have neurologists in Hawaii. We have people at Landstuhl in Germany. Those are really amazing opportunities. So I think you can look at the drawbacks and the benefits and see that they're just two sides of a coin.
How much say do you have in where you end up getting stationed? Is it like a lottery system, or is it totally random?
I was going to say either one of us can answer that. I will tell you that basically there are certain locations that are in need for any given year, and the cycle tends to be about 3 years. For physicians, in the old days, you could get stationed into a slot and never leave, but they have moved towards a more ready and deployable force. So I think that they are not as likely to leave you at a military base for your entire career unless you're involved in academics. Big picture wise, it's based on the needs of the military and based on your time in and based on how you want to rank them. So it's a little bit of a lottery, but not entirely. Now, I obviously left active duty in 2018, so Jen can speak to if there's been any changes in the system since then.
It's fairly similar. I would add that we're a small community of neurologists, and so there's a lot of say in terms of reasons why people need to be in one place than the other. So I think, the Human Resource Command and the consultants do a pretty good job of trying to balance the needs of the Army, like Rachel said, meaning what slots need to be filled, that upcoming move cycle, as well as the needs of the people. So like if, there's family situations or whatever that pull one particular person towards one space, they've been doing a great job with kind of pairing folks in terms of duty placement. The only thing I would say is that Rachel's correct in that, 20 years ago or so, they were able to kind of homestead, and then they got away from that. Now they're going back again because the reality is the cost of living the cost of moving folks has gone up. And so to be at one place your entire career and never move if you're going to be in for a duration would be probably atypical, but there's a lot of room for kind of once you get settled and more established, and as you're especially more senior in the rank, to stay at one place indefinitely. There's processes so if you have kids in high school, to homestead. And so there's a lot of different nuances of when people stay in a particular area for a period of time that's balanced across like your training and your rank and your family's needs.
Now, my next question may be a little comical. I can't help but wonder when I'm thinking about, joining the military, is there any risk for somebody who's a medical doctor in the military of actually being deployed into combat?
The answer is yes. You need to be prepared to deploy. You're an active duty military soldier. I'm a reserve soldier. If there is a need, you're going to go. But I think you have to remember that the way military medicine works, you are going to be slotted into areas and based on your specialty. So a trauma surgeon or someone who's assigned to a fast surgical team, which is one of our forward operating surgical teams, are going to be in a much different position than someone who is back at the combat support hospital. So it very much depends on what role you're deploying into. Are you going out as a brigade surgeon? Are you going out as a neurologist? That is the reality of being in the military, and it's what you sign up for. But the roles in theater are very, very different, and I'm sure that Jen can probably talk more on this as well. You're not a frontline holding a weapon, driving a tank soldier. Your role in a deployed theater environment is going to be very much based on the needs of that environment and what role you're slotted into. Jen, do you have anything to add for that?
Yeah, no, I would agree. I think folks that are in the military, when we use the words deployment, especially as physicians, that really means that we're leaving our family members, which tends to be the biggest angst. I don't think that any of us come to that situation with the concern that, we're going to be out like running patrols. Now, in an active conflict, okay, so just like we have active shooter scenarios or mass shootings, you don't always get to pick and choose when something really bad is going to happen. If something bad happened locally, yes, you're going to do the same thing that anybody else would do. And if you're actively being attacked, more than likely you're going to be a willing participant and try to protect yourself. But for the most part, especially with neurologists, I would say for other groups, subspecialists, Rachel's correct. But neurologists are either going into those brigade surgeon spots, or we're going to like a cache, which is, if you ever watched the show MASH, it's kind of like a military field hospital, and that's what you're deploying to. The other option for deployments are particular taskers, so really cool humanitarian missions. So not all of it is combat related, or I would say conflict related. Some of those deployments are for humanitarian relief or really cool missions. When we look at deployments, that there's a lot that goes into that. I think that word is probably the most stressful piece for most of us, and a big, kind of decisional factor for joining.
Jen, can you tell us at what point someone who has joined the military as a physician, at what point can they move on from it? And why did you decide to stay?
You can, when you sign up for whatever your obligation is going to be, you're going to have a year time frame. So like Rachel mentioned, her commitment was 3 years, mine was 4. You have that initial obligation, just like a contract, for any other job that you would sign, basically. When you complete that obligation, you're free to move on. So, for me, I went through and did my residency training, and then I owed 4 years after that. And when I completed that 4 years, so when I went out and took my first job as an adult neurologist, at 4 years, I was able to decide, do I want to leave, or resign my commission from active duty service, or do I want to stay on and sign? You can either sign another commitment obligation at that point, or you can just not sign any obligation. You go year to year, because it takes about a year to transition off active duty service. But for me, really initial decision branch was whether or not I wanted to go to fellowship. So I was almost done with my initial obligation and really weighing whether I was going to stay in or whether I was going to go out. And I made the decision to stay on to do fellowship with the military. That incurred a little bit of an additional commitment. And then at that point, I decided to sign on again because, honestly, I actually really enjoy what I do. And right now, I'm the program director for one of the programs for our neurology trainees, and I get to see my subspecialty clinic, and I like the people that I work with, and I like the stability of the healthcare and even the income through the pandemic. And so right now it's the right choice for me and my family. But that's why I stayed in. I enjoyed what I did. I love the people I worked with, and I was excited about some of the opportunities that I still have left to pursue. So it wasn't quite ready to hang up my boots just yet.
And what about you, Rachel? Why did you decide to stay in even after your contract had expired?
So I stayed in for a little bit longer on active duty than what my initial contract was. There came a point in time where I wanted to do a fellowship, and the fellowship that I was very married to doing was back home and is a civilian fellowship. There comes a point in time in the military with fellowships, and every single specialty in the military is different. But some are more willing than others to let you come back into civilian training versus if they have the training available on the active duty side. I wanted to come to the program that I'm at now. I'm an assistant residency program director here at my university. I really wasn't prepared to not serve and really wanted to stay on in a reserve capacity, which I have found to be just a fascinating transition in regards to the roles that I have now. I've been a brigade surgeon and I'm now a deputy surgeon. So my roles are very different in the reserves than they were as an active duty neurologist. It's been a really amazing experience. But I really wanted to come home and do the fellowship that I did, and I'm really glad that I had the opportunity to do both.
Do you only see active duty or veteran military personnel, or do you see their families or other people who work for the military? Who's the patient population?
Minimally, you have to have some service connection to be seen by military personnel, unless you're local trauma. So if there's local trauma, right in front of the hospital, and you're the closest hospital, those folks are going to come to you. But everybody at some point has to have some access or some, whether they're retiree or they're active duty, basically connection to the military. So that's the first part. But then outside of that, it's really, you're seeing everybody from the active duty service members to their family members, so spouses, children, and then all of the retiree population, which are the folks that went on to do pretty much a military career and have lifelong military healthcare benefits, also typically their spouses. And so really kind of children to adult, but some connection and basically eligibility to have TRICARE as your insurance.
Rachel, anything to add to that answer?
It's a little bit of an add, but a little bit of an extension on the training as well. I think it's important to note that the military has a program called the Extraordinary Family Members Program, EFMP. And what's really neat about that is that if soldiers have a family member with very special medical needs, they are moved into some of our military bases that have specialized service lines. And what's really great about some of our locations is there's a lot of pediatric subspecialty clinics. There's every specialty that you might need to see at our larger MTFs. And I think that's really important, both from a service standpoint, because if you're worried about your family serving with you and their needs. And I think it's also really important to discuss from a training standpoint, because when you hear oh, you see soldiers and their families. Well, they're like 18 to 35. What diseases could they possibly have? You also have to remember that the retirees and their family members, depending on what level of retiree healthcare they have, are eligible for care. In addition, the military training programs all have relationships in their local area with other hospitals. So you do out rotations and train and see people in the VA and see people in civilian hospitals. Like when you're in Seattle, you do have rotations at Harborview Medical Center. So there's really a lot of opportunities that might not be available at your first thought on it. And Jen, as a program director, could certainly attest to that.
Yeah, I would agree.
Cool. Well, what would you say to someone who might be listening in and considering a career in military neurology or in military medicine in general? Any advice, Jen?
Yeah, I would look at it like I'd look at any major career decision. I tell people when they ask me, really go into it, do your research, understand what you're signing up for, understand what your life may look like, make sure that you're comfortable with, all the different requirements. So if you're somebody who hates to exercise and it's just going to be a chore, probably military life might not be the best for you, because there are certain things that are required of me that are not required of other neurologists. But, looking at it, in terms of opportunities, and when you talk to people, don't just talk to one person. I guess it's not that different from other experiences with other groups or hospitals, but everybody has a different experience based on what was going on with their life or the opportunities that came up while they're in training. And so talk to as many people as you can about what they liked, what they didn't like, kind of see how that aligns with what your priorities are, and then make sure you vet through whatever the recruiters are telling you. Make sure you read through the paperwork and just truly understand what it is you're signing up for, both for the good and the stuff that you're not as thrilled about. And I think if you do that, there's just a lot of really fun and unique opportunities throughout a military career. And I would say, you don't have to do 20 years. You can do, whatever your obligation is and move on. And there's a lot of benefits, and stability that can come along with that. Folks that I see that seem the most dissatisfied tend to be the ones that just really didn't understand what they were signing up for. And so I think that would be the best thing that I would say. And then, just look at all your other options and make sure it's the right choice for you.
Rachel, what advice do you have for our listeners?
Well, I am going to piggyback off of Jen because her answer was beautifully said. I think if you also are already married or in a committed relationship or have a life partner or children, or you're responsible for, let's say, your parents, you want to make sure when you talk to the recruiters that you ask them to get you in contact with other healthcare providers. I help our recruiting station if there are medical students that have questions. And sometimes I've had the medical students say, hey, my spouse has questions. Could you find me a military spouse? Ask the questions. Take advantage of the people that are there to help you to make sure that you're making the most educated decision that you can.
Excellent advice from both of you. Thank you so much for taking your time today to talk to us about this unique opportunity.
Yeah, thanks for having us.
Neurology Nuts and Bolts podcast was created and produced by myself, Sara Schaefer. This podcast is not recorded as an official podcast of any institution or organization. The podcast is unfunded. Opinions are those of the individual participants. Music by Audrey Nath. Artwork by Shivani Ghoshal. Want more content like this? Be sure to subscribe to the Neurology Nuts and Bolts podcast wherever you get your podcasts to hear more about constructing your career in neurology. Follow us on Twitter at NeuroBolts and on Facebook at Neurology Nuts and Bolts to stay up to date on new content and give us feedback on what you want to hear. And tell your friends. Thanks for joining us.